Another significant number of daily cases, with almost 180,000 reported in the UK. But new data from the Health Security Agency suggests the Omicron surge is beginning to shift. First, geographically, the epicentre has moved from London to the northwest of England, with parts of Lancashire and Cumbria glowing dark red on the map, the new hotspots. But the virus may also be moving up the age bands, certainly in London, which has been slightly ahead of the rest of the country. Figures from the Office for National Statistics suggest the proportion of Londoners with the disease peaked on Christmas Day at a little over 9%, but they've been falling since to just under 8% on New Year's Eve. However, that masks the potentially serious demographic shift. Prevalence has been dropping more steeply in young Londoners. In those aged 20, for example, it's down from a little over 10% to around 6%. But in the elderly, although rates are lower, they're rising more steadily. On Christmas Day, 2.8% of 80-year-olds had COVID. By New Year's Eve, it was almost 4%. And they're more vulnerable to serious disease. So who's being admitted to hospital then? Well, this is the age breakdown around England. In young people, admissions are flat. But the blue line here shows admissions are steadily rising in the over 85s. And you can see the beginnings of a rise in the over 65s in yellow. The worry is that they're already rising with the full effect of high case rates over Christmas yet to come. Now, the government is betting on vaccines to protect the NHS, but there's increasing frustration that some people are still holding back.
I haven't said this before in this whole vaccination campaign. I just want to reach out to all those who have not been yet vaccinated and say it's a great thing. But I also want to say to the anti-vax campaigners, the people who are putting this mumbo-jumbo on social media, they are completely wrong.
Only the booster gives a good chance of preventing Omicron disease, but uptake of the top-up jab is slowing in every age group now. In the over 60s, rates have almost levelled off at around 90%. But in the under 30s, there are already signs the rapid rise before Christmas is easing off, with uptake still only at around a third. The slowdown could be due to the festive break. But if it continues and rates of serious disease rise still further, the government may have to rethink its strategy.